Good afternoon, everyone, and welcome to Member Cafe. My name is Ann Gluff, and I'm part of the member engagement team. So I want to wait just a moment for our attendees to get logged in before we get started. Great, so it looks like our attendees have leveled off as far as those who are logging in. I hope some more will join us as we get started. So again, my name is Ann Gluff. I am part of the member engagement team here at Partners Health Management. So happy to be here with you today and so glad you've decided to join us today. So while Beth is getting ready to bring up the slides, I want to go ahead and just go over some general information. But before she brings up the slides, let me do one thing. I want to let you know that Beth Brooks is one of my coworkers, and she's here as our Zoom guru today. She is going to make sure that everything is up and running nice and smoothly. And then also, she'll be moderating questions later on in our session. And Stacy Lawrence, who is part of our member engagement team, is joining us today. She is going to be popping some information into the chat for you. That will be things like links and phone numbers, great information that you might want to just copy and paste right out of that chat. And then also joining us today is Cindy Troba. Cindy's the manager for our member engagement team. And we have some great speakers with us today, and I'm going to introduce them to you in just a moment. So our topic today is mom and a baby wellness. And again, I'm going to introduce them in just a moment. Let me go over a few housekeeping details for you. So today we're offering the session in closed caption. So if you don't need that feature, you can typically see it right on your screen there. You just want to look at the bottom of your screen and you can click on the closed caption and turn it off so that it's not in your way. This meeting is being recorded, and so want you to be aware of that. If at the end of our session you are on mic and sharing information, just be careful what you share. We don't want to share any private information online, and we are certainly available for you after the session or at another time where we can set up some time to talk with you. You can reach out to member engagement at member questions. You can reach out to Beth Brooks, member engagement supervisor, or myself, Ann Gluff. Let's see, what else do I need to share with you? The chat and the Q&A. So the chat, we are going to be chatting out to you information, but the chat will be closed out for you. But I really encourage you, as you're listening to our presenters, is to go ahead and put any questions that you have in the Q&A feature. Right at the bottom of your screen, if you're not familiar with Zoom, you'll see the Q&A, and there's a question mark in there. And so you just want to click on that and enter your question. And then when the time comes for question, Beth is going to moderate those. She's going to read the questions. And also during that time, you're able to raise your hand. So the raise your hand feature is also at the bottom of your screen, and it's under reactions. And react is, there's a little heart right above the word react. So if you just click there, you'll see where you can raise your hand. And let's see, these slides and the recording is going to be available on our website. That's something everyone always asks us. So that's going to be available under the member tab in on the partners website. We talked about the chat. All right, so I think we're ready to move on. So Beth's going to bring up the slides, and I want to introduce to you our guest speakers. So we have three wonderful guest speakers today. We have Crystal Swink, who is from one of our health departments, the health department in Davidson County. She is joining us today, and she is going to talk about her role at the health department and the importance of immunizations for baby. And then we also have Jessica Hoyle. She is our Population Health Impact and Development Partners Assistant Director. That is a mouthful of a title, but she is full of information for us. And she is going to talk about our Partners Program for Maternal Health. And joining her is Brittany Clark. Brittany is part of our care management team over the program for high-risk pregnancy, and they're going to share information with you about that and how it connects to the health departments in our communities. All right, so without further ado, I am going to turn it over to Crystal Swink. She is going to start us off.
Hi, I'm Crystal Swink. I am the SIMHARP, CMARC, and Community Health Supervisor at the Davidson County Health Department. I brought some information about the SIMHARP program and some immunizations for the first year of life. So what is care management for high-risk pregnancies? Care management for high-risk pregnancies is outcome focused with the emphasis on improving birth outcomes and reducing the rate of preterm and low birth weight births, and monitors the pregnant Medicaid population and prenatal service delivery system using data. SIMHARP applies to systems and information to improve care and assist members in becoming engaged in a collaborative process designed to manage medical, social, and behavioral health conditions more effectively. North Carolina's always tend to have a lower birth rate, so that is a very important program for us to share with people. So, and it's also meeting diverse and complex needs of members that require a holistic and person-centered approach, and addresses both physical and behavioral health. A holistic approach must consider the social determinants of health, like the conditions in the environments in which the people are born, live, learn, work, play, worship, and age, that affect a wide range of health, functioning, and quality of life outcomes and risk. The more complex the needs, the more comprehensive the approach should be for assisting the member with a care plan that addresses the whole person and collaborates with other systems that impact the person's well-being. So how does our program receive referrals for the SIMHARP program? OB providers complete a care management for high-risk pregnancies risk screening form that's typically completed at a patient's initial prenatal visit. They can also complete those at 28 to 30 weeks and again at 36 weeks if there's any changes. And then local community agencies and hospitals often refer to us, especially if a lady is hospitalized for some sort of condition related to the pregnancy, then typically we'll get a referral so we can follow up and make sure she has everything she needs. Our main focus right now is our current priority patient list, which is something that the prepaid health plans provide us with. That's updated weekly. And those are the members that they decide, are high priority and that we need to reach out to. We also receive direct referrals from the prepaid health plans. There's 4 health plans that Davidson County works with. That's AmeriHealth, Healthy Blue, United Healthcare, and WellCare. And then we go by scores that are calculated within Virtual Health, which is our documentation platform. Members that score 200 or higher are offered SIMHARP program as well. So how do we process our referrals? Our goal is to reach the referred or the priority member within 7 days of the referral, and that's 7 business days. We have several different methods in Davidson County that we can use to reach members, which include phone calls. We can meet with them at their OB office. We can go out to their home, or we can have visits with them in WIC. Our preferred way to meet with members is to meet with them at the OB office. When a member is engaged with SIMHARP, what happens? So we do a comprehensive needs assessment that's completed with the member. In that assessment, the following areas are addressed. We make sure we have all of their demographic information correct. That includes their home address, phone numbers, what doctor's office they're going to. We look at their family and their support system as well. Any pregnancy conditions that they may have with their current pregnancy. We also look at those previous pregnancies and conditions that they may have had with those and the outcome. We do a PHQ2, which is completed with every member. If indicated, we'll do a little further into the PHQ9. We also identify any psychosocial issues, any social or housing issues, nutritional issues, health care, utilization, and postpartum. Once they deliver, we can keep a client for up to 60 days after they deliver. The comprehensive needs assessment is updated every 30 days. We do establish a care plan with a member based on their needs. And then we determine their risk level. And what that does, that kind of guides us in where we need to be as far as follow up with those clients. And it's determined by the care manager, and that's all based on that comprehensive needs assessment, what we figured out from that, whether we need to follow up with them more closely, but typically it's every 30 days. When the members engaged with SimHeart, most of our interactions occur face to face. We've seen a lot of value in those visits face to face. They get to know us. It's not just a phone call. So we found that's really beneficial for a lot of our members. Our care managers assure that members are linked to any community resources that they may need. So those could include WIC, any social services issues that they may need, whether it's food stamps or Medicaid, if they're having issues with their Medicaid. We also refer them to a local dental provider, specialist if they needed, community agencies that provide baby items, support groups, mental health providers, housing, transportation, local food banks, and other community agencies. The care managers work closely with the OB providers and communicate member needs. We have 3 OB practices here that are in Davidson County. So we have 3 embedded care managers at each of these practices that are there at least once a day to follow up with any clients that may need a follow-up. Care managers assure that the member is aware of any value-added services provided through their health plan and provide the member with contact information to access these services. So that's SimHeart in a nutshell. And then they had asked for me to talk about immunizations in the first year of life. That is something that our CMART program really kind of focuses in on, is making sure those children receive any necessary vaccines and are up to date on their well child visits. All children in North Carolina must be vaccinated against certain diseases. Immunization records are checked when a child enters any like child care program, school, or anything like that. So we strongly encourage that they stay up to date on their vaccines. North Carolina has several vaccines that are required for attending schools. Those would be the hepatitis B vaccine, the rotavirus vaccine, the DTaP vaccine, the HIV vaccine, pneumococcal vaccine, polio. And then as they get older, around 12 to 15 months is when they start receiving their MMR and their chickenpox. Most of those vaccines kind of go on a schedule of they get their first Hep B vaccine at birth. They'll get that vaccine again at 2 months. And then they get dose 3, which is the last dose of that vaccine between 6 and 15 months, typically. The rotavirus, DTaP, HIB, and the pneumococcal and polio vaccines, they get again at 2 months, or they start at 2 months, get their second dose at 4 months, and typically get their third dose around 6 months. And then their fourth dose at 12 months. That's about it with the first year of life immunizations. I've also kind of gave some information for you guys to look at if you want to in regards to what diseases do those vaccines protect against. So I'll let you look that, on your own time. And then I've provided the references, and I appreciate you guys listening. I'm going to pass it on to Jessica Hoyle now.
All right, thank you so much, Crystal. I appreciate that information. Hi, everyone. Thank you for tuning in this afternoon. Thank you to Member Engagement for inviting Brittany and I to talk a little bit about the pregnancy program here at Partners. So the objectives, what we're going to cover in the next few minutes includes our Partners Pregnancy Program, the Pregnancy Management Program that's administered by NC Medicaid, the care management for high-risk pregnancy. We're going to talk a little bit about the link between SIMHARP and Partners, and then also our Partners care management resources and support. So Partners is committed to supporting our members at every stage of life. And so our pregnancy program is designed to offer help to members who are pregnant. People who identify their pregnancies early and receive appropriate health care are less likely to have serious complications and healthier outcomes. They're more likely to have healthier outcomes. Through care management and support, this program ensures that expecting members receive the best possible care. So you may be wondering who's eligible for the pregnancy program. At Partners, any member of Partners who is pregnant can participate, and your care manager can help you learn more. So if you're interested in knowing more about the pregnancy program or what we have to offer, we highly encourage you to reach out to your care manager to find out more. Our pregnancy program does have multiple parts. There's the pregnancy management program, SIMHARP, and then resources and support from the Partners Care Management team. The Pregnancy Management Program is a coordinated set of high-quality clinical maternity services to all members who are pregnant and are enrolled in Tailored Plan Managed Care. This is a set of services that's identified by Medicaid as covered for people who are in Tailored Plan and who are pregnant. This pregnancy management program includes a screening to identify members who may be at risk for adverse birth outcomes. If you're pregnant or you think you might be pregnant, it's really important that you see a healthcare provider as soon as possible so you can get set up for that prenatal care and increase your chances of positive outcomes. Your care manager can help you schedule an appointment and can help you find a provider in your area and in our network that you can see for your prenatal appointment. All right, I'm going to turn it over to Brittany Clark, who is from our care management department here at Partners, and she's going to talk to you a little bit about SIMHARP and the resources that our care management can offer to you.
Thank you, Jessica. With the SIMHARP program, it's a available program through the local health department for people with high-risk pregnancies. I think I saw someone in the chat ask the question, is this only provided in Davidson County? No, the SIMHARP programs should be available in all 15 of our catchment areas or all 15 counties. So I hope that answered your question. As far as high-risk pregnancy, we define that as a person who's pregnant and their fetus have a higher chance of experiencing problems, more problems than normal. Members may be referred by their doctors, community agencies, for example, Department of Social Services, WIC, or they may have a care manager as well who made the referral. Also, members can refer themselves by locating or contacting their local health department. Also, the managed care organization, the NCO, Partners, Alliance, whoever the member is with, they can also contact their local NCO and they can walk them through the process of making a referral as well. All right. So as far as partners, what do we do here as far as our care managers are concerned? We have care managers across the adult care management teams as well as the child care management teams. We have to have CM Hard care managers because it could be a individual who's a teenager who's pregnant, or it can be an adult, and we want all of our care managers to be trained, equipped, and able to support these members. So some of the the tasks that we typically take on would be to we offer support for pregnancy-related decision-making. We don't take a stance. We don't let our personal agenda or interest drive how we support our members. But if a member says, hey, I want to have this baby, I want to figure out what steps we need to take, we get them to the local health department or their OBGYN. But they may ask, hey, can I learn a little bit more about adoption? We may, give them some information on adoption agencies as well. But again, we just want to make it clear that we do not push our own, interests. We make sure that we're there to educate and support our members to the best of our ability. We also receive our referrals through NC Care 360 or HOP, which is in Burke and Rutherford County. Resources, we always want to take that holistic approach. We know that individuals who are pregnant, they can have some complex, unique needs. So they may have mental health conditions or living with substance use disorders, or maybe they're in recovery, or maybe they have an intellectual disability or autism. Those types of things we typically learn by conducting our own internal assessments, and we're able to wrap them around supports and link them to specific resources to help them, have a healthy pregnancy. Also, they may need, having a baby or learning you're pregnant can be very overwhelming, or it could be other life stressors. Getting to know the care managers want to work diligently to get to know the members, and also identify what additional supports they may need. So perhaps a referral is made for some type of counseling or group counseling or something where they can learn coping skills. Nurse-supported medication and education. We also have plenty of RNs, and we have a physical health needs team here and partners. And so when we have these very complex members who maybe they have multiple diagnoses and they're pregnant, we make sure that the care managers and supervisors, as well as our medical team, are aware of these cases. So we staff and we ask for any additional resources or support. So I think that's a really positive. That's very helpful for the members. PICS Health app, we have that, lots of support and resources to help manage through loneliness, as well as resources for, anything that you may need. There may be community baby showers or different resources in that app. Also a community of, I believe it's other women, other individuals who are pregnant. So there's, again, to help manage through the loneliness, you have some type of virtual connection. And finally, pregnancy education materials, how to have a healthy pregnancy, the type of appointments you may need, and other additional type of resources that you may need to have a healthy pregnancy. I think that's it. All right, Jessica, thank you.
All right, thank you so much, Brittany. I appreciate you sharing that information. So if you or someone you know is interested as a member of Partners and is interested in joining the Partners Pregnancy Program, your provider, care manager, or caregiver can refer you to the program. Email referrals can be sent to population health programs at partnersbhm.org. Again, this is a program that's available for our members who are pregnant. So next slide. All right, so in conclusion, Partners wants to help our members have healthy pregnancies. We do have care managers who can connect members who are pregnant with programs and supports, whether they be through the local OBGYN or the SimHeart program or some of our in-house resources. We want to connect members to what it is that they need to help them have the pregnancy that they want to have. If you're pregnant or trying to become pregnant, we encourage you to call or message your care manager, find out what's available for you. All right, I think we're gonna take questions at the end. Here's my contact information and Brittany's contact information. Thank you all so much for having us this afternoon, and I'll turn it back over to Ann.
Thanks, Jessica and Brittany and Crystal, for all that great information. So Beth, do we want to take a moment right now to answer questions anybody might have for our wonderful guest speakers? I think there are a couple in there. Yes?
Yes, I'm going to give everybody just a moment to get prepared to be back on camera. Okay. All right. The question that we have is, can partners speak about the potential change in care management for the 2025 year, since it was just stated that the local health department performs this task?
I think I understand the question. So the CM Heart, our internal program here at Partners, is to work in tandem with the local health department. It's not to kind of step over their roles and take over their tasks. And as I mentioned earlier, that we have 15 counties, and so each county could be very different as far as their capacity or some of what resources they have. The way that I like to see Partners CM Heart program is that we essentially walk alongside the member to help catch and meet any outstanding needs. So perhaps Forsyth County, they don't have car seats, right? So then that's an opportunity for Partners to jump in and say, hey, let's help find and do some research in a local community to see if we can get this mom a car seat for her baby. So we look to fill those gaps and support the local health department.
Thank you so much for that answer, Brittany. We don't have any more questions, but I do encourage you to either raise your hand and we can unmute your mic and you can speak your question, or please type it into the Q&A. I'll give you guys just a moment, and then we've got a little bit more of Partners information to share. Okay, I'm gonna go ahead and pass it back to Ann, and I will get the slides ready.
Great. Thank you, Beth. So Beth is going to bring up a few more slides, just going to share a little bit of information with you about Partners. And we are going to start out by talking about the tailored plan. So they launched July 1st. They launched. We are now tailored plan. Partners is managing a tailored plan along with the other tailored plans across the state. You know, there is Via to the west, and Alliance kind of in the middle of the state, and then Trillium over to the east part of the state. So we are all managing our tailored plans. We are excited to say it's been a successful launch, but you know, when anything new happens, there's always some bumps in the road. So I am really super proud just to tell you how hard Partner staff has been working to reach out and talk to members that have been reaching out to us to ensure that the issues have been solved. And we continue to diligently work towards all of that. So with that being said, one thing I want to share with you is what you're seeing on the screen here is this is an image of Partners website at www.partnersbhm.org. And so I really encourage you to select the tailored plan frequently asked questions if you have questions. You know, peruse the website. You may be able to find some additional information and details. And there's a phone number there too, and I'm going to talk about phone numbers as well as we move forward. So let's go ahead and go to the next slide. All right, the member ID card. This is a card that you should have received in the mail. And I am just going to be forthright right here. I know there have been a lot of, not a lot, but some issues with the member ID cards. And so if you are not aware, if there is an issue with your member ID card as a member, or perhaps you're somebody who works with a member that has an issue with an ID card, there's a couple of different ways that you can get some help with that. One way is if you just go right to Partners website, select a tailored plan, right at the top, you'll see a link that says, need a new ID card? Click here. So, and it is going to take you to our website. You're going to actually see the member ID card, very similar to what you see right here. And right underneath it, it'll say English or Spanish. You want to click the one you need, and it's going to, form is going to come up, really simple form that you can make a request to get a new ID card. So I wanted to make sure that you were aware of that. Your ID card in general has a lot of information on it. Should have your Medicaid ID number, obviously your name. It's going to have your primary care provider. And that's another area where some of our members have needed a new card because the primary care provider was incorrect. And again, please reach out to us if you're having any issues with that. So your primary care provider is there. The other thing I wanted to point out is right on the front, to the right side of the front of the card, there's some information for your pharmacy. You see that BIN number, that information that your pharmacy needs to fill your prescription. But also right there underneath that information is a phone number. And that phone number, the staff at the pharmacy can call that phone number if they have any questions. You can also call that phone number as a member if you have questions. And then on the back of the card, there are some additional numbers. There is our main number for the member and recipient services line, and that is 1-888-235-4673. And that is our main partners access phone number, where you can access our nurse line, our behavioral health crisis line, pharmacy line, all of those numbers, which I'm going to show you one more time. But I just want you to know that that ID card is just a great resource for you, and you want to make sure that you carry it with you when you go to your appointments. All right, there. So now let's talk a little bit more about those phone numbers. So if you look at the top line, that is member and recipient services. That is our Partners Access Call Center. Again, that number is 888-235-4673. It's available to you Monday through Saturday from 7 a.m. to 6 p.m. For Medicaid members, it is for individuals who are receiving state-funded services, or perhaps you're interested in state funding and what it covers. You can call that number to get some information. Also, that number is available to really anyone in the community, specifically our stakeholders that work alongside us with our members that have Medicaid. So it could be a school, could be another agency. So that's that 1-888-235-4673. The next line I want to point out is the behavioral health crisis line. This number is available 24 hours a day, 7 days a week. And that number, 833-353-2093. It's available to anyone. So what's a behavioral health crisis? It is connected to mental health, or perhaps maybe a severe substance use disorder. You can call for yourself, or it could be maybe that someone's with you that's moving through a crisis, a family member. A licensed clinician is going to answer that call. They're going to help you with what's going on, going to get some details from you. They may provide information and connect you to treatment and resources, or perhaps if it's needed, deploy a mobile crisis team to you. So that's the behavioral health crisis line. The next one is about transportation. This line is for tailored plan members. And so if you're a member of the tailored plan, you can call this number to schedule your ride to your doctor's appointment, perhaps to the pharmacy to pick up that medication that was prescribed by your Medicaid doctor, or maybe another Medicaid treatment or service that you're receiving. And that number is 833-577-2309. Monday through Saturday, 7 a.m. to 6 p.m. If you're calling that number for the first time, you want to make sure that you have your Medicaid ID number. That because the person who answers the phone is going to ask you for that. You can do it, it's automated. You can answer the questions automated, or at any time when you make that call, you can indicate that you want to talk to a live person if that's what you prefer. So non-emergency medical transportation, also sometimes referred to as NEMT. The next number is the nurse advice line. And that number is 888-369-2452. It's open 24 hours a day, 7 days a week. And this number is also for our tailored plan Medicaid members. It could be that you want to call this line if you're experiencing some symptoms, you're not feeling well, something's going on. Maybe you've had a minor injury. And this will give you the ability to talk to a nurse. They're gonna do what's called triage the situation, which means they're gonna share with you what you need to do. So that's what they're there for. So again, for tailored plan members, and it is 24 hours a day, 7 days a week. The next one is pharmacy services. I mentioned that a little bit before when I was talking about your Medicaid ID card. This number is also available 24 hours a day, 7 days a week. Our members can call if you have questions or concerns. Your pharmacy staff can call if you have questions or concerns. Your provider that writes the prescription, if they have questions or concerns, they can call that pharmacy number. And again, it's on your Medicaid card if you need to refer to it. And the very last number there is called our provider services number, which is also on your Medicaid card. And this number is for your medical professionals, your providers that give treatment. It's a number for them to call if they have questions. It could be about a process, a procedure, to get their billing in, just a question in general. And that number is 877-398-4145, and it's open Monday through Saturday, 7 a.m. to 6 p.m. So these are all the numbers that can help you contact Partners Health Management. All right, the Partners Health Library. This is something that I'm very excited about. This is just a great resource. So Partners Health Management has partnered along with a company called HealthWise to create the Partners Health Library. And so it is similar to a library, but you don't walk into it. It's right online. You can access articles about health conditions. You can access videos and tools. So we believe here at Partners that it's really important to have the right information to make good decisions. So this is just a way for you to access materials here online. You can access this on the Partners website under the member tab and then resources. You can also access it through our member portal, which I'm going to share a little bit more info with you. I believe it's on the next slide. But the Partners Health Library is just a great resource. You can walk through it. Our care managers utilize this with our members that maybe have diabetes, or it could be COPD, a lung condition, or any condition. A lot of information out there. So Partners Health Library. All right, Member Connect. This is our member portal. Members who are part of the tailored plan or recipients can create a login. And so to create that login, what you're going to do is go to Partners website, and right in the upper right-hand corner, you're going to see the word Member Connect, and that's what you're going to want to click on. You see that red circle right there. So let's go ahead and move to the next page, and I'll tell you a little bit more about Member Connect. This is just a quick visual of what your landing page looks like. Here, you will be able to access your benefits and eligibility. What that means is you'll be able to see your Medicaid information, the start of your plan date, the end of your plan date, all really good information to be aware of. You'll also see the address that Medicaid has for you. That's something that's really important that you keep up to date. I'm going to share a little bit more about that before we end our session today. You can request a new Medicaid ID card from Member Connect. You can request to change your primary care provider. You can access information here. You can access the Partners Health Library. You can access some health assessments that you can do yourself. Very confidential. Could be that maybe they are connected to your mental health. So could be that you're feeling down, feeling sad, but you're not sure if you need to reach out for help. You can access an assessment online that you can do for yourself, and that can help you give you a better picture of kind of where you're at. And again, that is all confidential. You can also access our provider search. So if you're looking for a new primary care provider, perhaps you're looking for someone to provide mental health services or services for intellectual and developmental disabilities, all accessible from Member Connect. So that is Member Connect in a nutshell. So now we're going to switch gears for just a minute and talk about transition of care. So what is that? As we've gone through all of our Medicaid changes, there are times when you may need to transition between health plans. Maybe you, or maybe it's someone you're working with. So what are the reasons that you would transition between plans? So one would be if you yourself, your service, your treatment needs have changed. Maybe something has become more intense or something is new, or perhaps it's a member that you're working with and their service needs have changed. It also could be because the member has moved and changed their county of residence, or their Medicaid status has changed. So what do you do when there's a need to transition between healthcare plans? One of the things that you can do is you can, especially if it's a change in your service needs or your treatment needs, you can talk to your primary care provider or your Medicaid provider that you're working with, and they can help you with that. They can help make a request to change the health plans. You and your provider can also go to the North Carolina Medicaid enrollment broker to locate the form that's needed. It's called a request to move form, and that gets completed to prompt this transition of care. But I want you to know that there is a team of people here at Partners in place to help that transition to go as smoothly as possible. So we often meet, we being the team of people under transition of care, meet with the other health plans. Perhaps you're going from the standard plan to the tailored plan, or the tailored plan to the standard plan. Those agencies, companies are talking together to make sure that your transitions go nice and smooth. All right, member engagement. That is the team that Beth and I are part of, and a few other people here on the call with you. So what is member engagement? Member engagement, we're here to educate, to advocate, to help our members navigate our service system. It can be a little overwhelming, a little complex. So you can reach out to us. There's a couple ways you can reach out to us. You may meet us in the community. We attend resource fairs and have tables where we can provide education. We also do presentations. You may see us there. But you can also reach out to us via email by sending an email to memberquestions@partnersbhm.org. Put your information in there, and someone from the member engagement team is going to contact you. I encourage you to put your phone number in there so we can give you a call and really have that direct contact with you so we can get a real feel for what your needs are. The other thing that you can do is reach out to that Partners Access phone number that I mentioned a few times. That's that 1-888-235-4673. And you're going to select member services, and you can ask to speak to a member engagement specialist. If you're just not sure who to talk to, we can help you get to the right place. So that's member engagement in a nutshell. All right, our PICS mobile app. You heard Brittany mention that earlier. That is an app that we have that focuses on mental health and mental wellness. It focuses on the epidemic of loneliness. It also provides support for women who are pregnant. We are really focused on that this year, women and babies, to want to make sure we give you all the support that you need. So Pix Health is a mobile app. You download it to your phone. You'll need your Medicaid ID number and your member ID number with partners to get connected. The Pix Health mobile app, we have a special connection to Pix Health, and we provide additional materials for you. We also have a Great Day Healthy Rewards program. So if you download and sign up for Pix Health, you can get a $10 gift card. There's information on the website about that. But if you're interested in Pix Health, you can go to www.hipix.com. You can see it on the screen. There's also a phone number there that Stacy's just popped into the chat, and that's 1-855-499-4777. And so I want you to know that when you use this Pix mobile app, if there's a lot of contact going on, a lot of questions going on, there is someone that you can talk to with Pix Health. It's called a compassionate call center. And also Pix Health communicates with us here at Partners so that we can both support you. So it's a great app. Give it a try. All right, just about ready to wrap up here. So I want to remind you that it's really important to stay in touch with us. Keep your contact information up to date. Medicaid sends out a lot of information. We send out information to you, and it's important to keep your address and your phone number, your email address up to date. If you receive Medicaid, you want to contact your local Department of Social Services to update your information. And if you receive state funds, you want to contact our member and recipient services line, that 888-235-4673. And you can share your updated contact information with us, and we'll get it updated. When you talk to your local DSS, they update that information in the state Medicaid system, and that gets shared with us on a constant and continual basis to keep that up to date. All right, stay connected. So if you want to stay in the know about information at Partners Health Management, changes, updates, you can grab that QR code that you see on the screen. If you have your phone handy, that'll take you right to our website to the Stay Connected. And then Stacy also put that link right in the chat that you can grab. You're going to click on that green button there in the center. It says subscribe. You're going to be able to enter your email address and indicate what information you want to receive. So you can receive updated information for you as a member or a provider or a stakeholder in community or all of the above. So stay connected. And last, but certainly not least, your feedback is so important to us. I know everyone asks you to take surveys. We're all inundated with surveys, right? This survey will take you just a few moments, and it really helps us continue to better the information that we share with you. If there are topics you want to hear about here at Member Cafe, you can enter that into the survey. We do get that information and review it. So again, QR code right there on the screen for you, or the link at the bottom of your screen to access that survey. All right. So we are at the end of our session today, and it looks like we have a few minutes left. Last chance for questions. So if you have any questions about Partners, the tailored plan, Medicaid Direct, Partners manages both the tailored plan and Medicaid Direct, and the tailored plan includes state funds. So if you have any questions, now's the time. Or if you have any more questions for our guest speakers, Crystal, Jessica, and Brittany, about our pregnancy program here or about the CM HARP program or other programs at the health department, we'd be happy to do that. If you think of a question right after you pop off of here, Stacy just popped into the chat that member questions at partnersbhm.org. All right. Well, I want to thank you for joining us today. It's been a pleasure sharing this information with you. And please plan to join us next month. I believe our topic for next month is about wellness and healthy aging. So we'll be glad to bring that information to you. So I'm going to give you just a few minutes back in your day. I think it's about 8 or 9 minutes. So just for you, a gift. So thank you all for joining us and have a great afternoon. Bye-bye.